Hello, everyone. It's 6:30, so it's time to begin our panel discussion. It is my great pleasure to be moderating this session and welcome everyone. Welcome to our great panelists, but of course, welcome to all of our amazing participants. My name is Alicja Baska. I'm a physician, public health specialist, and a co-founder and executive director of the Polish Society of Lifestyle Medicine. And I'm really happy to be moderating a discussion with the title, The Right to Know, Food Transparency as the Foundation of Health Rights. I think it's a big subject, very important, and we know all that clear, transparent food information, we might say, is a cornerstone of health rights, the foundation for rebuilding trust in our food systems. And in this panel, we are bringing together experts in many different fields. We have experts in clinical nutrition, cardiology, sustainable activism, local governance. We will be touching very many different aspects of their daily work and life. And please allow me to present our guest speakers. I will firstly tell a few words about each one of them, but if you feel like adding something more, that would be important for our discussion, please feel free to do so. And I will start with introducing Dr. Shireen Kassam, a leading voice in plant-based medicine, a physician, hematologist, founder of Plant-Based Health Professionals UK, who is leading the way in educating healthcare professionals, mostly doctors, in plant-based nutrition for very many years. Hello, Shireen.
Hi, everyone. Great to be here.
I would like to introduce Dr. Tomasz Jeżewski. He's an interventional cardiologist, internal medicine specialist with extensive clinical experience. And he's also an advocate of lifestyle and preventive medicine, educator, blogger, creator of the Zawałowcy project. And he's also a member of the Scientific Council of the Safe Food Federation. Hello, Tomasz. Nice seeing you.
Hello, everyone. Thank you for having me.
And next will be Councillor Ziggy Klazes. Sorry if my pronunciation is not perfectly correct. She's an influential local government leader championing sustainable food policies and community health initiatives, proving us that it is possible to impact food policies and to be part of a local government driving the change. Welcome.
Thank you very much. Thanks for having me.
And last but not least, George Hayek, MBA graduate, founder of Lebanese Vegans and the region's first vegan social club, leader of Hayek Hospital, the first plant-based hospital in the area, advocate for ethical and health-focused living. Welcome, George.
Thank you for having me. Hello, everyone.
Okay, so as I mentioned in the very beginning, the subject is very, I would say, multi-sectoral. We could have many different perspectives when trying to approach it. But I would start with asking you, how do you understand the title of our session? What does it mean for you from the perspective of your day-to-day work? What the food transparency is for you, and how do you connect it with the health rights? Maybe Shireen, if we may start, it will be easier.
No problem. Thank you. So yes, I guess from my perspective as a clinician and an educator, I think that transparent food information is absolutely fundamental if we're going to safeguard both human and planetary health. So at an individual level, people have the right to know what they're consuming so that they can make choices that protect their health, reduce their risk of chronic disease, and align with their personal values. And too often the ingredients, processing methods, environmental impact of food are obscured or downplayed, so leaving people and the public very disempowered. And I think this is much more than just about sort of personal health. Often the lack of transparency serves the interest of powerful food corporations whose profits kind of depend on us being in the dark, and they aren't necessarily very transparent about the harms caused by their products. So it's no coincidence that, you know, our food environment that's full of highly processed, unhealthy foods that are destroying the environment are often sort of aggressively marketed, while their consequences to the health and the planet are often hidden. So that's kind of how it affects you know, my work and what we do with patients and fellow healthcare professionals.
Thank you very much for your perspective, and thank you for touching this very important subject of commercial determinants of health as well, for bringing this attention not only to the individual health, but also the health of the whole society, the whole population, and the commercial entities that are also involved in this picture. And I would like to give you right now a bit different perspective, and let's look at the perspective of the local government leader. Ziggy, if you agree, what for you the food transparency is, and how do you perceive it from your daily work?
Well, personally, I think it's a very important subject. Can you understand me? Yes. Audible.
Yes.
Okay. But it's not necessarily something that we deal with on a daily basis in our local government, obviously. Me personally, I think it's a matter of personal integrity. What we put in our mouth and what we eat is very important, and it's very important for our personal health and also our degree of well-being and happiness even. So we should really be in charge, and we should really be in control of what we eat. And therefore, to be in control, to know what we eat, we need the information about it. So it is definitely a very important issue, but it's not something we talk about on a daily basis in the city of Haarlem, where I'm from, in Holland.
Yes, thank you very much. Tomasz, and back to medicine, but this time a bit different perspective of a cardiologist, but also a preventive and lifestyle medicine perspective. What food transparency means for you? Is it important?
You know, in my everyday practice, I see patients that suffer from largely preventable diseases. They like hypertension, like coronary disease, like heart failure, type 2 diabetes, insulin resistance. Our impact, preventive impact, can be really huge, but these patients are not adequately warned by the food system what parts of the system contribute to their problems. So this lack of food transparency makes prevention very hard for majority of my patients. So we know that the food can be a kind of medicine, but it is true only when patients know what's inside. So that's why it resonates, this subject resonates with my activity.
Thank you very much. Thank you for bringing the patient education as a very strong tool also here to the table today. George, would you like to comment on the food transparency from your very interesting perspective?
Of course. First, I think that the title of the subject is very important, and it's more like a moral responsibility for everyone to be transparent, especially when we're talking about the food system. The food system is the energy of our body, and when we're not transparent, we don't know what we're injecting in our body. There goes the chronic diseases, there goes the cancers, and there goes the pandemics. Not long ago, we suffered from COVID-19, and all major diseases, as we all know, comes from eating animals and what comes from their body. But the thing is that with the lack of transparency, people are not well informed. I can talk about my personal experience at the hospital. A lot of my patients don't know exactly why the cow produces milk. We can go out to this level of education, of transparency. People just think that a cow just produces milk because it's a milking machine. So we have a lot of education to do, a lot of awareness to do, and a lot of transparency should be done. And I truly believe that the reason behind lack of transparency is two major aspects. First, it's addiction to flesh and secretions. And second is profit making and money. So when we realize that the people in charge in the politics section, well, the majority are not vegan and the majority are politicians and they maybe search for profit making, there goes the lack of the reasons, I believe, the reasons why we lack a lot of transparency. When in 2015, the WHO stated that meat is classified in the same group of tobacco, the highest classification of carcinogens. And no one knows till today, big majority of people are not aware of this fact. When the cancer research as well state the same fact. A lot of transparency should be undergone, and it's more as a moral responsibility for everyone to be knowledgeable in order for each person to be able to make informed, adequate decisions.
Thank you, George, for also bringing this subject of lack of food transparency as a major barrier. And I would like to go back to Shireen to ask her, how does she feel? How does she perceive the change in this situation? How does she perceive training healthcare professionals, for example, to be the science communicators? Do you see any change in any chance in changing this situation that we are facing today?
Yeah, so I mean, I think, we know that healthcare professionals, doctors, nurses, dietitians are very much trusted professionals. They're trusted in society to provide us with, the right knowledge and science information. But as I think a lot of us are witnessing, much of this science communication is getting confused as we've got, numerous sort of social media outlets and podcasts and quite a lot of sort of misinformation or spread of misinformation. So I do think it is down to, people within healthcare to make sure that nutrition education does focus in on the evidence base. And, we know that, for example, we can really bring the evidence into simple messages. I think patients and even, families and clinicians and everybody really need just simple messages on how to make better choices, because it's not complicated. It's made complicated to keep us all rather muddled, but the basics of a healthy diet that promotes good health, prevents chronic disease, supports the planet, is one that centers around whole foods, mainly plant-based foods, and we should be sort of supporting patients, particularly sort of in my role, to be able to make these small changes, because any small steps towards eating a healthier, unprocessed, plant-based diet is going to benefit them in terms of their disease burden and for helping manage their chronic conditions as well. So I think we really should be confident in being able to share these simple messages around small changes.
And are we? How would you assess the readiness of the healthcare professionals right now?
Yeah, that's a good question. I think it varies considerably. I think, some people have taken it upon themselves to get qualifications in nutrition and lifestyle medicine, many of us in this group already. So we've been motivated to do that and empower ourselves to be able to share this message. Whereas I think a lot of medicine is still in its silos. You know, we are very super specialized in small areas and don't often see the bigger picture. And it's often the bigger picture that benefits from better nutrition and so forth. Whereas at the moment, we sort of wait for people to get the condition and then are very much focused on pharmaceutical and technological solutions rather than lifestyle medicine. But I'm speaking to the converted with your hat on lifestyle medicine. So I think it needs to be all brought together. In the UK, there is now the 10-year health plan that has recognized prevention and healthy habits as being a real core tenet of you know, improving public health, but we're yet to see whether they'll support you know, citizens to actually adopt these healthy habits.
Thank you also for giving us some hope, because often when we meet at meetings like that, we tend to speak about the lack of nutrition education in medical school and so on and so on. But we can see that there is a growing group of people who self-qualify also because they feel that there is this lack. And we also can see that there is more and more nutrition education also in the curricula. So let's hope for these changes to happen more and more often. But once we speak about nutrition education, once we speak about how patients might be confused, I would like to ask Tomasz how or what common misconceptions about diet, nutrition do you encounter most often? And how do you see this, for example, clearer food labeling or transparency help address this kind of misunderstandings?
Yes, a lot. I see a lot. Thank you, Shireen, for addressing these education issues. But I think we need a lot of systemic solutions and clear information for our patients, because I have occasion to talk to my patient on average 20 minutes. I consult one single patient, and amount of information I can pass is very limited. People are alone during their shopping, during their, you know, choosing what is right, what is healthy, what's maybe not. And the kind of information they encounter is really different, and the many tricks they encounter. From my perspective, I'd like to address very briefly just a short list of them. For first is hidden sodium and the link to a lot of problems. It's so simple, but we still have this huge problem of hidden sodium, of salty snacks, and the connection is so obvious, so well established with a lot of diseases, from hypertension to kidney diseases, strokes, and this is a huge problem. And we know that if we manage to pass the information, we can cut 1/4 of cardiovascular risk of cardiovascular events. So it is huge benefit for the population. The second, briefly, it's of course added sugar and metabolic problem diseases. This is a problem of, you know, as Shireen was addressing the social media issues. We see high carbs, low carbs. We have a lot of information about carbohydrate, but it's so confusing for my patients. We need to address added sugars as a clear information, because some carbohydrates can be healthy. Added sugar and connection with the metabolic diseases is a huge second problem. And the third, it's of course UPF, so ultra processed foods. Of course, we are vegan summit today. We have a lot and more plant-based food to pick and choose from, but no, we know that some of them have one ingredients, but the other have 20, for instance, and they are ultra processed, and we have a lot of problems explaining our patients what is the difference. But the difference should be addressed on the label in clear manner for my patients, because I cannot explain during my meeting with patients all those information. So misinformation and the package labeling is a huge problem, and we should push this evolution forward.
Thank you very much. And thank you also for bringing to the table the issue also of the time that is very limited, for example, during the medical consultations. And this brings me to Georges again, because in this whole discussion, I think it's also very important to notice that hospital might also be a learning environment. That might be a place where a patient not only sees a good example, but also have an ability to follow this good example and start his journey into their habits transformation. So I wanted to ask you, how do you see the role that hospital settings and, for example, changing food at hospital might play a role in our today's discussion and the challenges that we're already mentioning?
Of course. So for me to take the decision to turn the hospital vegan, it took me around 1.5 years to 2 years. During this period, I had intensive educational sessions to, of course, my staff, the nursing team, the administration, and the doctors, and of course the public, because I wanted the education to be a well-rounded education that will be able to reach everyone. Because I didn't want to do this or take this decision overnight. A lot of conferences, a lot of documentary screenings, a lot of speeches were held in order for the ground to be ready for me to take this decision. So as you mentioned, a hospital is as well an educational ground. What I did in my hospital is that all around the premises of the hospital, you can find posters that educate people on the dangers of eating animal products versus the advantages of having a plant-based diet. So people enter the hospital, they start staring at those pictures, they start taking pictures, they start having some conversation with people around. And of course, once they enter the clinic of the doctor, they start asking a curious question. This is exactly what I wanted. I want this conversation to be open, and I want this conversation to be mainstream. It's well about time to be talking about the root cause of our diseases and not just treating symptoms. As Dr. Shireen said, we are expert in the pharmaceutical section to give medications and treatment, but we are full in tackling the root cause of problem and lifestyle medicine. So I truly believe in prevention. I truly believe that what we inject in our body will only but show in the near future. Our body is a mean of transportation, same as a car. If our car we put some bad fuel, it will break after 2 kilometers. Same goes to our body. If we fuel our body with bad or poison, I call animal product poison, because whether it's my hospital or any other hospitals, we are full of patients that are heavy meat eaters, that are heavy dairy eaters, and all the studies, all the facts, all the reviews, peer reviews showed to what extent it is illogical to anyone to be consuming such kind of food, and especially in hospitals where we are supposed to be treating those diseases and those patients. Yeah, this is what I do. And of course, we have our vegan dietitian. Once she undergo her patient's visit, she educate them on the importance of letting go of animal product and to adopt a plant-based vegan lifestyle. Of course, not all our patients will adopt this lifestyle, but at least I'm trying to like forward a message that if a hospital is serious about the subject, if a hospital removed completely animal products and replaced them by plant-based, maybe there's something we should know about. Maybe we should dig more. Maybe we should do more research on that matter.
It's about also bringing or building the awareness, as you said, even if the change is not possible for a person at this particular moment of their lives, right? But I also wondering about the common misconceptions around plant-based diet, plant-based eating, and one of the misconceptions is that it's untasty or that it's difficult to be followed. So I wanted to get back to you, George, about and ask firstly you and then our speakers, was it really the case once you introduced vegan meals at your hospital? What was the approach? What was the how
Yes,
was
of
it
course.
received? Yeah.
Then again, we go back to the misinformation, miseducation, and lack of transparency. People believe that when we talk about protein, it means meat, and when we talk about calcium, it means dairy. There goes our role to educate. We should educate on the fact that all our nutrients, essential nutrients that our body needs, we can all find them in the plant kingdom. And basically, you said about taste, and the taste is not there. It's not true, because basically what gives the taste of flesh at the end is the dead flesh that doesn't have much of a taste other than being than rotten flesh. It's the spices, the plant-based spices that we add on the flesh so that we can have a specific kind of taste. So again, in a plant-based kitchen, we use those spices, but instead of dripping those spices on a piece of flesh, we just put them on some tofu, on some soy protein texture, on lentils, on mushroom, and there you go. You have the same taste minus the antibiotics, minus the growth hormones, minus the saturated fat, minus the cholesterol, minus the cruelty towards the animals, minus the damaging the environment, minus the damaging our health. Well, yeah.
Thank you. Thank you for your reply. And I'm really interested, I'm really curious how you in your clinical practice, Shireen or Tomasz, also face this common misconception.
Well, I'll just jump in. I mean, I guess I work in a cancer profession, and so everyone asks me, what shall I eat? What can I do to improve my chances? And to be honest, it's not a big surprise when you tell people they need to focus on, fruits and vegetables, swap out their red meat for beans, think about, cooking from scratch. But I think, as Thomas indicated, it's hard for people if they don't have social support. If they don't have adequate finances, time, resources to sort of put that all into action. And, so then it comes down to that piece around supporting sustained behavior change, which we are not very good at within healthcare. And unlike Georgia's, we at my hospital don't even role model like what the optimal way of eating is. Unfortunately, we still do have processed meat on the menus, and so sugar sweetened beverages in our retail shops. So it gives people completely the wrong information, when actually we should be using this as a moment to educate them when they're the most motivated. Once somebody tells you have cancer, that's the most motivation you'll have. But then we just ruin it by showcasing the wrong things, and then there isn't that community support, and the food environment in the UK is terrible, with the big commercial entities putting stopping government and policymakers from actually making those changes that we need to see. So I think patients understand. We just need a better sort of wraparound support system.
Thank you. Tomasz, would you like to add something, comment on that?
Yes, I would like to add my wish that I would like to work in George Hospital because it's a sad story because you know, I am an interventional cardiologist. I implant some stents, and a couple of minutes later I see the food passes the corridor and is given to the patients, and no, the reality is that the majority of this food is pro-atherogenic and causes problems. So that's what Shireen also said, that we don't give models, and it's like medical schizophrenia, and it is a bit sad. But we should work on it. And Alicja, you in Poland do a really nice job. So a lot of misconception. We now we talk about this the most visible and true. What kind of example and model we show our patients in the acute phase. They are hospitalized, they are in a big crisis, and we serve them food which is not a proper example. And now we want to talk about convincing the you know, the industry to properly label the food. We have a lot to do.
Yes, yes. Thank you very much. And once we speak about these examples, I would like to get back to you, Ziggy, and ask how can local governments then effectively engage citizens, businesses, healthcare system to support the transparent, ethical, health promoting food systems.
For example, what I've done, I did go and visit the hospitals in Haarlem, and also the sports and schools, and asked them if they were willing to change their diet towards a more plant-based diet for health reasons. But I'm really interested in, since you're all scientists, what can you do as a scientist to get the message across proactively to say it's better to change your diet, and without, you know, put the finger out there, so you should really stop eating meat or lessen your meat consumption, but do it in a nice way, in an attractive way, to sort of persuade people to cut down on their meat consumption without them having the idea of us as our bubble taking something away from them. And I think for some reason that scientists have a very important role in that, but I think, but maybe I'm wrong, I find them quite absent in the public discussion when it comes to the change towards a more plant-based diet. So I'm interested what the scientists amongst you have to say about that.
The question is also whether actually is it often a case that the politicians or decision makers always listen to the scientific argument? Probably it would be wonderful if it was always the case. But I guess that some of us can also share some experience with that not being actually the case. And I can see Shireen nodding, unfortunately. So if you can comment on that, because it's a very interesting issue. Thanks for bringing that.
Well, just to add some information that I find it very interesting to talk to scientists, because if I want to get something across and I want people to follow me, or at least say that's a very good policy you thought of, I need the input of scientists, because if I don't, I'm just mumbling, I'm just saying whatever, and people will say that you just made that up. So I really need the facts and the figures to get my point across. The example, the reason I'm sitting here, people might be wondering, what's this woman from Haarlem doing here? We in Haarlem, we banned meat advertisement for health reasons, animal care and or animal welfare reasons, and also the climate reasons. In order to be able to do that, I had to get information from psychologists on how advertisements actually influence the people in the streets. And if I wouldn't have had that information, and really solid information and numbers and figures, I would probably not have been able to get this motion across, and the ban would not have been installed. So that's the reason I'm asking this.
Yeah, thank you. Thank you very much for sharing this experience, because it also shows how complex process. It is what we've been doing for years, and no one is right now questioning, or very few are questioning, and we are just doing some things because they've been done like that for many years, because there were some lobbying into doing the things the way they are right now, and everyone is comfortable doing it, and the big industry as well. But thank you also for pointing out that scientists, healthcare professionals have their role to be played. And I think that this is something that is very soothing for us all to hear as researchers, as scientists, because many of us experiences sometimes a completely different perspective, and I would wish to us that we have as many politicians and decision makers as you, with your open mind and a perspective to listen to the scientific evidence. I don't know if you, Shireen, wanted also to add something to that.
Yeah, just don't underestimate your role in this. So I'm curious.
Well, that's really kind to hear, because I think from our perspective, often as healthcare professionals, it's very difficult to feel that you can get your voice heard. You know, the amount of time we spend emailing our MPs, or trying to speak to them, or trying to get to the health minister, and it seems certainly in the UK you have to sort of pay your way into getting face-to-face time with politicians and policymakers. And just as an example, because it's going to be quite current soon, is the Eat Lancet planetary health diet. You know, that has been devised and written by 37 eminent scientists, researchers and clinicians around the world, and it tells us very precisely, you know, how to eat a healthy diet that will not only promote our own health, but also the health of the planet. And that planetary health diet, you know, was launched in 2019, and it had zero impact in the UK. I'm just hopeful that the relaunch in the first weekend of October, we're going to be able to make a bigger noise about it, because, yeah, I mean, some countries, there's obviously some countries that we really know have tried to follow the recommendations, like Denmark have updated their dietary guidelines. But, you know, for the UK, we haven't updated our dietary guidelines since 2016. It doesn't consider sustainability. It hasn't reduced the recommendation for requirements for sort of meat and dairy in line with planetary health. So I think it's hard for us, and it's often quite demoralizing not knowing how to start to access our decision makers, essentially.
Thanks for this perspective.
Can I have something else?
Yes, of course.
Because I'm not going to take over this conversation, but I'm just curious that you try to approach politicians and policymakers, and I do know that they are not immediately willing to listen to you. I mean, the meat lobby and the dairy lobby is much stronger, much bigger, and they're everywhere. So your lobby it's really hard to understand that. But what if we would all start on a consumer level and making clear to the consumers that eating too much meat is unhealthy, but do it in a way that we're not trying to force you into eating less meat, but find a way like social influencers do, and they're very successful. I mean, I think there's this guy who eats nothing but meat, and he gets a lot of attention, and we all know it's very bad for health, but he still gets a lot of attention. So is there a way possible that consumers can be influenced by the same way? You talked earlier about short messages. There must be a way to get through to them in the same way that social influencers do. And I know your desperation. I feel it. I get it totally. And I wish it were different. And I think it may be a good idea to start at a consumer level, but maybe you don't agree. I don't know.
Yeah, I mean, I think it needs to be, you know, bottom up, top down, doesn't it? We need all of those aspects, and certainly as a healthcare professional, I try and influence those areas where I can, which is that healthcare setting. And we, like others, are working to sort of make plant-based meals the kind of normal preferred option in hospitals and healthcare, where we do have a kind of trusted voice and can access those sort of decision makers on a smaller level. But I still think it's hard for consumers to make that the kind of healthier, sustainable choice when the food environment does not put out these messages. So we can, as individuals, and maybe we'll have some influence in our small sphere with patients and families. But I think, you know, for more widespread change, we need more consistent messaging, like you're doing with advertising, but advertising, whether it's billboards or media, social media, television, etc.
Yeah, thank you, Shireen, for addressing again the food environment context and the fact that consumers, patients are all the time being under the influence of very many different messages, often being the strong marketing messages that we know from research as well that are effective. I'm wondering, what would you see? And it's a question to all of you as potential opportunities, but on the other hand, the barriers for implementing the food transparency at the community level. We already mentioned the big lobby, this being one of them, and probably quite difficult to address. I don't believe, unfortunately, that we'll find a solution during our panel discussion to solve this, but we know that the problem exists. It's well documented also when it comes to the Eat Lancet report that you, Shireen, mentioned. We have a well documented story of how the big lobby was lobbying against the Eat Lancet report. Even before it was launched, the campaign was already there. So it's quite scary and strong. And as I said, it's something that was well documented. But moving from this one barrier, would you see any other? And if so, do you also see some kind of light, some kind of opportunities or the ways to address these challenges?
Yeah, I think we can see some light because some labeling systems are already been used, are introduced, like Nutri-Score, like some solution in certain countries. Maybe they are, scattered around the globe, but it's good to have some examples that some solutions were already introduced, and we have them, some in Israel, or maybe like black labels or front labels on the food. Of course, there will be no one perfect solution. We should work on because there is still a discussion about what's good and what's bad in, for instance, Nutri-Score. They will never end, but still we have them. And when I observe teenagers, they look at those grading charts on labels of Nutri-Score. So it works in a way, but we know that we can do better, and we can go deeper, and we can improve, but still it's a long way to go, but there are examples, so let's go further.
And from your perspective, what kind of information should be prioritized in these labels?
Yeah, from my perspective, I think that the level of the food processing, it's not clear enough for people, because the two, let's say, again, plant-based not always means healthy, and we should clearly state it. Some of the plant-based animal food mimicking products, let's say, can contain 15 or 20 ingredients, and some have one, and it's not completely clear for people, and it's not properly addressed. This added sugar issue for me is very important, added sugar, because we tackled a little bit the trans fat, let's say, because they are banned in many countries already. But this discerning between carbohydrates and added sugar, it's very important in my opinion, for instance.
Thank you. Thank you for bringing also the example of trans fats. That is already a lesson to be learned. We have good studies from Denmark, I think, that shows us actually that there was a reduction of cardiovascular deaths due to the ban on trans fats being added to the food. So we have a clear, we can say, governmental intervention on the policy making level that turned out to be successful. Coming back to my question about the challenges and opportunities, would anyone of you also want to comment on that? Do you see? I think that that Ziggy wants to add. Yeah.
Yeah, maybe I'm mainly talking from a consumer's perspective. If I go into a supermarket and I need my reading glasses to read the back of the package to see what's in it, I sometimes don't have my reading glasses with me, so I don't know what's in it, and I'll either put it back, or when it looks really good, I might take it anyway. I think what would really help is and I don't know if it's possible, and I don't know if maybe it's done already, but if you can put a QR code on every package, so you don't have to read the small lettering, but you can just point your mobile phone at it, and maybe you can even install your preferences. Like, for example, when you're vegan, you look for products that are vegan, and if you put your phone on the QR code, it will tell you immediately whether it's vegan, how much sugar, how much salt, whatever allergies you might have, you can maybe install in this preference settings. And maybe it already exists, I don't know, but I think it might be a very good idea to make it a lot easier for people that are not everybody will do this, but you make it as easy as possible for consumers to do the right thing, or at least be able, make it able for them to enable them to know what's in the product.
Perfect. I think that very recently I came by the information about the QR codes labels that are being introduced. I'm not sure if it was food first or was it cosmetics for now, but I think that it's going to be happening, and I think it's great that we can also involve some technology to make our lives easier and probably healthier. But once we are speaking about the labels, and once you were having a mic, Ziggy, I wanted also to ask about Switzerland. Switzerland, that was discussed recently quite a lot. Probably all of you participants today might be aware of that, but I will just make the start and describe. Switzerland is introducing a law starting in July 2025, so it's already there, that requires mandatory disclosure about animal suffering in food production. How would you assess, from your perspective, this initiative, and do you think similar regulations could or should be adopted elsewhere?
Well, first of all, I commend every step that's being taken to make to disclose the information about animal suffering. The main reason I drafted this motion to stop advertisement for meat products was exactly that, was for animal welfare. That was my main reason. However, I don't know if this is going to work, and I understood that this is what do you call that? An initiative in Switzerland that came out of a failed initiative to ban foie gras in Switzerland. They wanted it not to be able to be sold anymore in Switzerland. That didn't happen, and instead of that, they put the labeling on the packages. I applaud them for that. I'm not sure if it's going to work, because if we look at smokers' information, if we look at cigarette packages, and it says very clearly, you will die if you smoke the cigarette, people will just not look at the labeling then. And if you're a meat lover, I'm not sure if you're going to really look at the package that says this animal has suffered tremendously before it reached your plate, and if that will make a change in consumption. I'm not convinced. The best thing to do for us politicians and policymakers is see if we can really change the suffering on the beginning of this process, and really try really hard to do something against the mega stables and the slaughterhouses. And I think the best way to disclose the information about animal suffering is make make slaughterhouses out of glass and mega stables out of glass, and in that way people would actually see what's going on behind these walls, because people don't see it and they don't want to see it. And that is never going to happen, but it would for sure be the fastest way to turn everybody vegetarian, or at least the people that have a heart into vegetarians. So but I commend them, Switzerland, for doing this. It's a step. I'm just not very sure if it's going to work the way we would like it to work.
Thank you for this comment. Probably the time will show us, and I hope that someone is going to be actually researching that to give us answers to these questions. Shireen, George, do you have something to? Yes.
Yeah, well, only to add that I'm also less convinced around the impact of labeling on individual behavior change. I'm not convinced that the evidence has supported this as a way that consumers make better choices. I personally think the evidence points more towards changes in regulation, reformulation, whether it, ideally compulsory, but sometimes even the voluntary recommendations around sugar, salt, like we've mentioned, saturated fat, those sorts of things. And then, kind of how we position them within the supermarkets and how we promote them. Because ultimately we know people choose things that are convenient, that are cheap, familiar, tasty. That's kind of how people make their decisions around food choices. And so a bit like, tobacco and taxation, it was only once government regulation really came into force and limited where people could smoke, not inside buildings, public spaces, etc. Did the rates really reduce? Certainly in high-income countries, and I think that's really what we need. But maybe just I could add, because I can see that somebody's asked this or had. Oh, well, maybe it's disappeared now, but somebody had mentioned about, how we could prescribe fruits and vegetables, and that is a way of changing behaviour. So in the UK, we've had some success through what we call social prescribing, where, doctors and link workers can support people who would benefit from eating more fruits and vegetables to, have vouchers that will give them discounts or free amount of food with these vouchers if they qualify for them, and that really has shown, and equally in sort of studies that have come out of other countries as well, that sort of prescribing and supporting people to be able to access more fruits and vegetables does actually result in them and their families eating more and improving their diet quality. So I think those sort of initiatives, certainly within the healthcare setting, could be useful and more widespread. I think the trouble is that it's often run by charitable organisations rather than directly from government or local councils, and so it's very much dependent on funding, whereas it sort of just needs to be embedded within the sort of healthcare funding budget.
Thank you. Yes, and this kind of activities are very often quite scattered and being developed by very many different actors, and it's just not sustainable. But also thank you for pointing out the power of fiscal solutions. The report about the commercial determinants of health from the Lancet from 2 or 3 years ago pointed out pretty strongly that if we want to act against the commercial actors, we do really need strong, powerful decision makers and policies that would, in a way, protect our society, and that fiscal solutions are very often very effective. But also we need to be focusing on supporting or creating the environment that would support these healthy choices, support in a way that they are more accessible, they are more visible, that they are the default ones. So creating this healthy environment where the healthy choices are the obvious choices probably would be what we will be all thinking about and wishing for all of us. I was wondering if Georges, you want to comment on this discussion, on this section of the topics that were brought up right now.
Sure. Now, while we don't have the desired results concerning cigarettes, but I think that it's essential, and going back to the topic of our discussion today, food transparency is human rights. So it's our right to know if what we're eating is classified carcinogenic in the same group of tobacco, yes or no. This should be a human right to everyone, the right to know, to learn more about our choices that we do on a daily basis. Now, I don't know the statistics about cigarettes and smokers, but I don't know if we've reached the desired like results. I doubt. But then again, at least the smoker is aware that he is damaging his health and the health of others in the room. Same should go to meat and dairy and animal products. When we know that meat is carcinogenic, it should be labeled as carcinogenic. Red meat 2A, processed meat 1A. So this is a small example of the labeling that should be mentioned. Again, it might not be the only solution, and it's far from being the only solution, but I think that it might be a good step in the right direction. A lot of people, because I can tell you from my own experience at the hospital, they don't know that meat has been classified back in 2015 as carcinogenic. They think that it's healthy food and it's protein and it gives you muscles and it gives you a healthy life where you survive and thrive on it. At least let's give the customer, the consumer, the information, and at least we've done our job. Now it's up to the consumer to take responsibility not to consume such kind of poison.
Thank you very much. I would also like to underline that all of these efforts, of course, should be very sensitive also when it comes to different socioeconomic levels, that very often, unfortunately, the ones who suffer the most due to chronic diseases, due to diet-related diseases, are those of the low socioeconomic status, and that probably we should always remember that all of the regulations, all of the changes should also be prepared in a way they don't create additional stigma, additional divisions and health inequalities. We see the big gradients, for example, in obesity in children and in adults when it comes to the place of residency, the socioeconomic status, and so on and so on. Coming quickly or coming slowly towards our Q&A discussion, I would like to ask one more question that is, I would say, a bit striking or controversial issue when it comes to speaking about, on one hand, about the human right to healthy food, and on the other hand, observing the discussion about personal freedom and a freedom for choice, freedom to choose. Very often, different regulations, for example, taxation, sugar tax, and so on, are perceived by individuals or parts of society as being intruding their freedom of choice. How would you tackle this? How do you perceive this kind of perspective, or how would you discuss with it to convince individuals that this kind of regulations are actually protecting their rights, their human rights to health.
I can give you an example at my hospital. Now talking about freedom of choice, is it a choice for anyone to be smoking a cigarette in a hospital? It's not a choice. Maybe it was back in the 50s, but we evolved and the studies have shown the danger of smoking. So we cannot offer food that damages their health, that damages the environment, and that causes massive suffering to animals. This is not freedom of choice. Simply, this is a way to damage your body, to damage the environment, and to inflict suffering upon others. Personal choice, it involves yourself, nothing but yourself. So then again, I can stress on the fact that is it a choice that we give for a patient to at the hospital if he wants to smoke a cigarette or not? What if this patient starts saying, where is my freedom of choice? I choose to smoke. This is my personal choice. Well, no, it's not a personal choice here. I'm really sorry about that.
Thank you. Thank you very much for this perspective. Anyone also would like to add to that? Ziggy, yes.
Yeah, I'd like to emphasize that we as a local government, but also as a national government, any government for that matter, has the duty to keep us healthy in any way possible. Because it's not just food we put into our mouth, but it's also, for example, pesticides that really have an effect on our health and our neurological system. It gets into our body and it really affects our health. And it's up to the governments to make sure that that doesn't happen, that the factories that produce chemicals that get into our body, they have a duty to, governments have a duty to take away that risk. And if it goes for food, anything you put into your body that's harmful, they at least have the duty to make it less harmful and see what they can do to add less salt or whatever they have to do. It is their duty. It's one of our roles as local governments, local politicians, to keep our people safe. That's what we do.
Perfect. Thank you. Shireen or Tomasz?
I have a strange impression that the food safety and the information connected to the food health impact on our society lags behind the, let's say, water safety, air pollution or air safety, lags behind the cigarette smoking. And this is a little bit strange because we talk about the freedom, but it is clearly the so huge, so big part of influencing our well-being, healthy, longevity, and it really lags behind I mean the regulation, safety, health impact, passing the information, labeling, even giving all those people a right to choose what they would like to eat, but passing this information clearly, because we see that a lot of people still, of course, not in public places, but still smoke. Apart from the 30% of the package area clearly stating that it causes harmful and all the stuff, diseases and impotence. They have this kind of freedom, but talking about food, this whole big area lags behind, and it's so sad for me from my perspective.
Thank you. Shireen, do you also want to comment on that, or should we move to the question and answer session?
Yeah, for sure. Let's move to the question and answer.
All right. So I would want to remind everyone also that the question and answer feature is open, so you can still leave their question, and we have a couple of minutes to answer that. One of the questions that comes up is a question: does criticizing all animal-based studies reduce the amount of evidence for the harmfulness of humans consuming animal-based products? Would anyone like to comment on that?
So is the question around studies that use animals as their basis of investigation? I mean, I think
so, yeah.
Yes, I think the evidence does clearly suggest that most animal-based studies don't translate well into humans, and we can't. I think we have to accept that data, and the more we move to more sort of human appropriate models, the better. I don't think it is a problem when it comes to examining the effects of diet on health. Many animals, for example, don't really get atherosclerosis in the same way that we do, or the same sort of cancers and things. So I don't think it weakens our evidence. I think we've got plenty of human-based evidence, whether it's observational, short-term interventional, that demonstrate the key tenets of a healthy diet. And for me, I think, when we have got our own subjects, human subjects, where we can do studies using humans for answering dietary questions, it's just a complete tragedy to be using animals in that setting.
Shireen. There is a question about the examples of public finance, such as development banks and grants, in support of plant-rich diets. The participant says that he or she is aware of an EIB to ORA. Are you aware of any other such positive practices, how this can be scaled up? Anyone, maybe?
Okay,
let's...
I might just say that, I mean, obviously everyone uses this as an example, but the Denmark government have really got themselves sorted in the last few years and have got a plant-based action plan, and therefore government money is being used to support plant-based businesses. So that's one example, but I think it's going to be very context and region specific, rather than sort of understanding where one can get money for individual projects. I think it's going to have to be country dependent or context dependent.
Okay. And another question, speaking of medical professionals, where are the dentists in the movement? Maybe Shireen, can you tell us if you have known a lot of dentists who are interested in plant-based nutrition and joined, for example, your organization?
Yes, I mean, so we're a membership organization, and we certainly have dental professionals as part of our organization. And you're right, I mean, dental health is really dependent on the diet we eat and the health and the dietary quality. So we should be championing them. So I guess as conference organizers, we should make sure that dental health is part of the agenda and find these people. So, but I agree, I think we need more healthcare professionals across the professions and be more multidisciplinary. I could say the same about our nursing colleagues. So I think we need to champion all professions, and sometimes the doctors always get the limelight just because we are considered, I don't know, separate or different.
Thank you. And a question from Jenny. She asks if any of you know a figure for the proportion of doctors and medical staff who are even aware of the impact of whole food plant-based or vegan diets versus meat-based diets. She writes that there doesn't seem to be much evidence of patients being informed that whole food plant-based diet can help reduce the severity of their conditions or indeed reverse it. Still a primary reliance on medication and lifestyle status quo. Is any one of you aware of any research in that?
No, I am not aware, but Alicia, you are deeply involved in training doctors and medical staff and developing the curricula for such a training. So maybe you know.
I don't have exact data, but I can speak a bit about Poland, that we are doing our best to increase, of course, the presence of lifestyle medicine in curricula. Officially, it's there is lifestyle medicine within family medicine curriculum, but it's mostly on paper yet, I would say. But there were some studies, mostly from United States and UK, that were showing that there is, of course, quite low awareness and quite low knowledge of whole food plant-based diet, and in general, low levels of nutrition training in medical doctors.
I might just add also, I mean, I do agree with you. I haven't got specific statistics, but we conducted a study of dietitians in UK and Ireland, and we've published the paper asking them about their knowledge, attitudes, beliefs around the Eat Lancet planetary health diet. It wasn't even necessarily 100% plant-based, but we know that, it would benefit health and the planet. And unfortunately, from our small subsection of dietitians, we realize that they don't feel comfortable or sufficiently knowledgeable to implement plant-based diets into their clinical practice, and they don't feel supported by their profession. And certainly even those dietitians that had qualified within the last 3 years suggested that their curriculum during their degree course didn't cover this topic sufficiently. And I would argue that it's not us as doctors that should be necessarily the ones, the flying the flag. We've got plenty to do. Tomasz with his stents and myself with anti-cancer treatments. You still want individuals like us to be highly specialized, but we want our nutrition colleagues to be sufficiently educated on the topic, whereas I think it's still very stuck in the old curriculum, which we know was often influenced by the meat and dairy companies that provided the educational resources. And I still think that you find this at nutrition conferences as well, don't you, that various industry sponsors are funding various sessions. So I think we need to look across the board at curricula, not just for doctors who have such a wide range of things that we have to learn.
Yes. Thank you for stressing the role of other healthcare professionals and dietitians, nutritionists, but also our nursing colleagues. And we all have a role to be played in the well-organized healthcare system, and we all have plenty to do. And it would be very useful also if we all strengthen our messages and go hand in hand, which also does not happen always. We are slowly coming to an end of our today's meeting, our panel discussion. Thank you very much for being here. Thank you for your insightful comments, the replies to all the questions. Thank you to our participants. And maybe just to wrap it up, just one sentence from each one of you. What thought you would like to leave us today after our panel discussion in the area of all of the different subjects we've been discussing about a little around?
So my sentence will be, I guess, that I would like to have a stronger backup, bigger help from the system, allowing me to pass the clear information, or maybe to back up my information with clear labeling, clean information, social public campaigns funded by the governments, ministries. It would be my wish for, I hope, near future.
Thank you, Tomasz.
In what concerns me, I often get the question, why did Hayek Hospital remove the animal products and meat from their menu? And my answer for them is why other hospitals are still offering carcinogenic food for their patients. So it's well about time to look at the elephant in the eye.
Thank you very much.
I think I might just say, you know, a call to action, you know, that as healthcare professionals, we should all be using our trusted voice to see the change, you know, to support the change we all want to see in our wider society, whether that struggles with food or other injustices. So I think we have a voice as healthcare professionals, and the more that we use that, hopefully we can also be influence policy and decision makers.
Thank you. And Ziggy?
I would like to thank the other members of this panel, the healthcare professionals, for being so bold and brave to bring a message across. And I'll just try to find more information to see what I can do on a local level to promote this on a local level in our own hospitals. So thank you.
Thank you very much. I wish you all a great evening. And of course, I would like to invite you to join the next session, breaking down food silos towards sustainable global systems, that will begin in 10 minutes. So time for a little break, maybe active, and see you next during the next session. Wishing you a good vegan summit. Thank you, everyone.
Pleasure. Thank you.
Thank you.
Thank you, everyone.